Station.
Welcome back to the Debrief, where we're talking about the new feature on ChatGPT, where essentially you can connect all of your health records, your medical data, to an app within ChatGPT. And who knows what the future holds for this particular feature. Thank you so much to Shahab, who's been in touch, saying that he used ChatGPT to understand the lab report that he got from a doctor before he then got the chance to re-meet with that doctor. He did say, though, that he wouldn't blindly trust it, not yet anyway, but it did help him understand what's going on and got him more mentally prepared before the doctor's visit. Good point.
Very good point. And of course, this is because we're talking about ChatGPT Health, which, by the way, is also completely private within ChatGPT. So it doesn't train the rest of your conversations. It also doesn't train the larger AI language models as well in general. So it is kind of siphoned off within itself. Very interesting to speak also to our experts that we've gotten into the studio. Tech expert Evan Kraus, Vice Chairman, President, Board Member, and Chief Operating Officer at APCO Worldwide, and expert in the field of medicine and GP, Dr. Rhea Kotecha. Thank you so much for staying on with us, because we have many more questions, especially because there is a second sort of facet to this entire story. OpenAI also released a second new project last month, along with ChatGPT Health. It's called OpenAI for Healthcare. And its focus is not maybe the regular user like us, but healthcare organizations. So their aim is to help them kind of like scale their care and reduce admin work and help with sort of clinical solutions in those healthcare spaces. But its main product is sort of a ChatGPT for healthcare workers. So it gives almost evidence-based answers with citations from medical journals and studies and things like that, like what you were talking about at least it's trained on the correct software, the right information. But it almost gives you a lot of things as healthcare professionals, templates for common tasks like discharge summaries, patient instructions, clinical letters. It even gave the example in sort of the PR release of OpenAI of a doctor asking for a differential diagnosis on a patient. This is something that scares me a little bit, is the idea that a doctor could put into this ChatGPT for healthcare, this idea saying, I have this patient, he's presented with these symptoms, he's had this history, help me come up with a differential diagnosis. This is already something that's been rolled across kind of the biggest hospitals in the US. But what are your thoughts on something like this? Let's start with Dr. Kotecha. What are your thoughts on almost a healthcare platform that is used in organizations like this for everything from admin to diagnosis?
I think it could be extremely helpful, because a lot of doctors don't make mistakes because they're poor clinicians. It's because they're tired, they're burnt out, and they've got a lot of other things going on. We're all humans at the end of the day, and sometimes having a bit of structure, having a little bit more support could really help. You know, looking at differential diagnoses, you'll come up with the top 3, but you're not sitting there. I go back to like medical school when we'd be presented with a case and say, give 10 differential diagnoses. In clinical practice, I don't do that. I think about the first 2 or 3 and just kind of move on. But it's quite helpful, actually, to have that all that 10, and not to look at it and treat it as gospel and be like, okay, fine, I'm wrong. But evaluate the data, look at the information that you've been given, and really question, is there something I'm missing? Is there another question I need to ask? Do I need to look at it from a different perspective? What I used to love about practicing in the NHS was the MDT care. So that's multidisciplinary teams. We have chats all the time about different patients, and you get advice from different clinicians. Working as a GP here in Dubai, I don't get that. So unless I actually reach out to a colleague to ask for advice, often it's just me with my own brain. So it would be helpful to have that support from that perspective to bring up new guidelines, new evidence. And then you use your brain to think, is this helpful? Is this not? And also, it's quite, in terms of admin workflows, it would be incredible if it could write out all my insurance templates for me, finish all that data, and actually finish all my clinician notes, because I'm busy writing down all the details I need to get to complete this documentation. It takes away from that human connection I have with that person. So actually, AI working this way could actually make medicine more human again, in a way, because it's giving you that time back with that patient. It's giving you that connection back, and that's really beautiful.
And you made such a good point that so many doctors are tired, they're overworked, you know, especially when you look at the NHS in the UK. I speak to my family at home and they're waiting ages just to see a doctor when it could just be they've got a common cold or they've got something that's really easy to treat. And it could be that they just need to go and see somebody that's working in a pharmacy because they are also able to give the same advice, potentially. But it's being able to get that information from the doctor. And Evan, I guess this is more a question for you from the tech side. There's been a lot of talk about how eventually, and especially in the UK with the NHS, it could be that you're talking to AI, you're talking to more of an agent, a chatbot, to give your symptoms, and that will then tell you whether you should then go and see a doctor and go ahead with that appointment to see them in person. Do you see that being a genuine sort of view of how healthcare can look in the future?
I do, and it also, that part of it actually is the part that scares me, because there are enough unusual circumstances that if you're relying on that generalized advice, you could make mistakes. You know, there are plenty of examples, I'm sure you know more than I do, and on the physician side, but there are plenty of examples where systems present in one way, but there's actually something a lot more significant going on. So I think the beauty of all of this is if we can give more time back to the physicians to see more patients, and you don't have to wait weeks and weeks or months and months, that would be amazing. Because, and if those appointments became a lot more productive because the doctor, you had information to share with the doctor that was complete. You know, nobody remembers their medical information. No one remembers everything that they need to know. No one can think through their own histories, let alone, you know, if you're a physician and you have tons of patients. So if you could come more prepared, if the doctor could ask the right questions, if you could spend more time having that human diagnosis, then we worry less about, you know, overlooking someone that has an unusual condition that could be life-threatening that actually presents as something normal.
Now, we also have seen, you know, with this new piece of tech, and this is one of the techs that also has come in, the EEA has not yet allowed this, and they have way stronger sort of laws against this kind of tech being, you know, commonplace and used everywhere, and especially available to the rest of the public. Is that something that we need to then worry about and say, maybe if the EU has strong regulations and says no to this, is that something that is maybe something that the rest of us should be looking at, or is this just normal?
Well, it's not just the EU. In the US, there's a special regulation called HIPAA that talks about medical data. We treat, in the US, the government treats medical data and the rules around it differently than any other kind of data because of how sensitive and important it is, and there are rules. I live in the US, I have a child that just turned 18, and they won't even share her medical information with me because she's an adult legally under the law. And so it's not just the EU. And there's a reason why medical data is treated with more care than other things, because it is more sensitive, and we should be more protective of it because it's essential to ourselves. So I don't think that those fears are misplaced. I think as a general rule, the EU's philosophy is to regulate first, you know, advance second. I think in the GCC, I think the instinct is to advance first and regulate second. That those are not necessarily one is better than the other, but I think there is a reason why health data is protected so carefully.
And it certainly has to be. You made such a good point about how you've got a child, but when they turn 18, things get trickier when it comes to data and information. When I was 17 years old, I unfortunately was in hospital at that point. And the difference from when I was a 17-year-old to an 18-year-old in terms of the information and the terminology and the way that the doctors explain things to you were worlds apart. And there was even one scenario where I was in hospital and I didn't understand what these doctors were saying to me, but I trusted them. And if there's a tool that can help a patient, especially a younger patient, understand all of this complicated terminology and information that they're being given, I think there are benefits to it. And I think that the way the technology is going, there are definitely good aspects to it, but then there's also the information and the data risk. Liz has made a great point about, you know, a company like OpenAI. What if one day they decided that they were going to buy an insurance company? That's where it becomes a little bit messy, and that's where I feel a little bit not sure about this whole ChatGPT and health side of things.
Excellent point.
Yeah, and you know, it's funny because you and I talk about AI maybe every other day. and we use AI definitely every day. And yet we're still nervous when it does come to anything to do with anything more than, the regular daily uses. We're such big proponents of it sometimes, and then the others, we're so nervous about it. And I don't know where that difference comes in. And this is a big one as well, because of course it is integrated into the systems that we don't understand. And I think that's where the difference comes in. We almost don't understand where doctors, it's information, like you said, Evan, that we don't know, and we're therefore a lot more fearful of it. Do you think, Rhea, I guess this is something that's been weighing on my mind. Is there some argument to say that there is this easy tool that's now available to us, like ChatGPT, to so many people in their workplaces? Do you think that this is the easy way out, that any doctor would maybe say, you know what, you can ChatGPT it and he gets that information very easily? Or is that something that's just never going to happen because doctors actually do believe in the best for us? Is there some weight there?
I think that's quite a big moral question to ask. And I think a lot of people will answer it. No pressure. Will answer it very differently. I think, sometimes, unfortunately, in the field of medicine, people want to make a bit more money, which is the case. If they want to see more patients, tick them off, it might be the case that it's easier to just get ChatGPT to do a lot of the work for you. I think it's how you practice medicine. It's what you believe is best. So a bit of a tricky one.
Okay, final question for you both. Are you going to upload, or would you feel comfortable uploading your personal medical data into a system like ChatGPT, OpenAI?
So I personally use an AI system for my clients and for my own health data, which is based in the Netherlands. And
full medical records?
Yes.
Okay.
Yeah. So they help me do my biological ages. That's all very secure, and I have the most beautiful graphs that tell me where everything is going, and I find it really helpful. So if it is a secure system and it is properly validated, it's trained on the right tools, it has the right guidelines in place and the right evidence, then yes, I personally would.
And Evan?
I definitely would.
Yeah. Straight after the show.
No big surprise. Yeah. I might do it tomorrow. I'm obsessed with knowing a lot about that and getting the data. I'm not a spreadsheet. Not much of a. I forgot your name.
Excellent.
I'm not excellent as Senna, but I do believe in data. Sorry, I know you don't like that.
No, it's all good. It's all good. I guess it's just going to stick now.
It certainly is.
But there's, I have my wife is a nurse, and she fields a lot of calls from people. She deals with a lot. She works in a NICU. She deals with a lot of parents, and it's amazing how unprepared, how unaware they are, and data and knowledge is power.
Yeah.
And if you can have better knowledge and insights for your own body and your own health and your own future, you should take advantage of that. And some of these risks about what's the health insurance company going to do with it, what they're trying to do is figure out how risky you are anyway. They're going to get to that at some point. Money. They were trying to they're trying to
make money. In my case, make money. They look at me and they see the dirham signs and they go, here we go.
They're trying to beat the actuarial tables, they would say. But I think that's your health anyway, and they're ultimately going to price all that in. And so, to me, I think the benefits far outweigh the risks because you can keep yourself healthier.
Absolutely. Well, thank you so much to our experts this hour, Evan Kraus and Dr. Rhea Kotecha. Thank you for being on the debrief. Really fascinating conversation this
really
hour.
Fun. Thanks for having me.
Let's see what the future holds for ChatGPT Health.
Dubai Eye 103.8 traffic.
Sponsored by Yas Island Abu Dhabi. Stay at iconic hotels and play at record-breaking theme parks.